everybody, I'm going to do a video on natural birth. I did one on C-sections, and so I'm going to go ahead and do one on natural birth as well. There are several different types of natural birth techniques and different ways you can go about it. The most typical common way nowadays is to have your baby in a hospital with doctors and pain medication and all that good stuff. For some people, this is not what they want. For some people, they're just not comfortable with a bunch of doctors and machines and pain medication. Um, there are other options. You do not have to always have your child in a hospital. The only circumstance, the only way that this is okay, though, is if you are completely healthy, you have not had any complications during your pregnancy, the baby is deemed as completely healthy, and everything has to be going smoothly. If your insurance will allow it as well, you also have to make sure your insurance will cover this. Um, and so, yeah, you want to make sure everything is safe and everything is allowing it to happen a different way besides going and having it in a hospital. Um, the different ways that you can go about natural birth, aside from having your child in the hospital, is you can have the baby at home with a midwife, or you can have the baby in a midwife facility where you still aren't hooked up to a whole bunch of machines. Every once in a while, they will just check the baby with a monitor or whatever and make sure the baby's okay, but you're not hooked up to machines the whole time. So you're able to get up, walk around, use different pain techniques, and to get through the pain and to push your labor further along. Because a lot of times, once you go into a hospital, as soon as you're there, you have to stay on the hospital bed because you are hooked up to machines that are monitoring the baby's heartbeat and the baby's movements and stuff. And the doctors come in and check to see how dilated and stuff you are. Once you're in a hospital, you're stuck on the hospital bed. But when you go to a midwife facility, you are not stuck on the bed. You can walk around. You can do all different kinds of things that help with your labor, making your labor go further along, and to get through the pain and stuff. Because when you go and do it this way, you don't have to be given pain medication. And but your midwife will have a nurse with her most likely to help with the medical end of it, and most midwife facilities are located close to a hospital so that if anything does go wrong, you're right there by a hospital, you can be taken straight to the hospital. But like I said, you can't really do that unless your insurance is going to accept it and allow it, and you don't want to do that if you have any kind of complications with your pregnancy. If you're not completely healthy, your baby's not completely healthy, if everything isn't going to go smoothly, you want to go to a hospital, not a midwife facility. Another way of doing it is also a technique called water birth, where you can have your baby in this big special made bathtub that gets filled up with water. It's made just for giving birth to babies, and it's for pregnant women. And you will have a nurse and a midwife there. A lot of people are kind of worried and iffy about this. This is kind of a newer way of going about having a baby, so it's not very common, and it's slowly becoming more popular, but it's not very common, and a lot of doctors are not okay with this. But for those who have given birth this way, and for midwives who've helped women give birth this way, they think that it's an excellent way to give birth to a baby because the water helps with your pain, the water helps with relaxing you, it brings the baby into the world very relaxed and calm, because the baby's been in your womb for 9 months surrounded by amniotic fluid, And so that's just a natural, comforting uh, environment when it's born into the water. It's like still being in amniotic fluid. Um, and the baby does not drown because, I mean, think about it. If the baby was surrounded by amniotic fluid for 9 months and didn't drown and die, why would your baby drown and die when it's born right into water? Because the theory of this is the umbilical cord has not touched the air yet. Your baby does not take its first breath of air until the umbilical cord touches air and like contracts. When the umbilical cord contracts and reacts to hitting air, that's when your baby breathes. But when you give birth in a bathtub, the umbilical cord is still in water. It has not touched air yet. So the baby does not take its first breath, which is why the baby does not suck some water in and drown. What they'll do as soon as the baby comes out is the nurse goes ahead and guides the head so that it doesn't hit its head on anything. And then when the baby's completely out, she'll go ahead and bring it up out of the water. You know, she'll use some of the water while it's, you know, she's holding it to clean it off, and then she'll hand you the baby while you're still sitting in the tub. And either you or your significant other or the midwife can clip the umbilical cord at that point. So that's what water birth is about. If you go into a hospital and do it the way most people do it these days, they're most likely going to give you pain medication, which is known as an epidural. An epidural, now different women describe an epidural differently. Different women who have had one describe it differently. But for me, in my situation, it did not hurt. An epidural is just, it seems real scary because it is a long needle, and it's put into your back up toward your spine. And what it does is it blocks the nerves from being able to feel anything from the waist down. So you're basically numb. For a lot of people, they try to go as long as they can before they get this pain medication because your body will naturally know how to push and naturally tell you when you need to push. And a lot of people like to listen to their bodies because that's just human nature kicking in. But when you have pain medication, it kind of prevents you from being able to feel all that. So doctors, they'll work with you on that if you want to hold off having it until, for a little while. But there's also a point where there's a point of no return, basically. If you wait too long to have the epidural given to you, they'll tell you, no, it's too late now, go ahead and have the baby. So women kind of are iffy on that. You either get it too soon or you don't get it at all because it's too late. You really got to talk to your doctor about that, and make sure that you and your doctor are on the same page ahead of time so that something like this doesn't happen to you. It's not unsafe for you to have an epidural. Yes, everything that you're given, your body influences what your baby feels and is given. But it doesn't hurt the baby. It just makes it less natural for birth. And it's going to be harder for you to feel yourself pushing. You're not going to really know too much about the baby coming out until somebody says something or you hear the baby crying. So yeah. Now, the whole giving birth and everything, for people who want to know about pain management, there's breathing techniques that you can do. There's also relaxation techniques that you can do, like dimming the lights or having music or something that calms you down. A lot of people like a good support system. They have people that they trust and that are comforting and supportive in the room with them while they're doing the whole delivery process. There's also, while you're not in hard labor yet, different things you can do, like with a yoga ball. You can sit on a ball with your legs spread and your hips, at a certain angle, and you just rock, in a motion to help with the pain. Or you can lean against a wall and have your, like lean against a wall like that, and have your significant other, massage and everything on your lower back, because a lot of people get a lot of pain in their lower back. Um, so there's different ways to deal with the pain. Um, there's also classes you can take if you want to practice it and have an instructor teach you how to do it. Natural birth is really great. It's the way that you were made and intended to have children. For those who have C-sections, though, even though that is the way you're supposed to have a baby, and you feel kind of gypped out of having the baby naturally, you shouldn't feel gypped. There are cases where you have complications and you're just not able to have the baby naturally. The important thing is that you are healthy and safe and you brought your baby into the world okay. It's not your fault if you had no choice but to have a C-section. With my son Logan, I did not plan on having C-section. I had to have a C-section with him. It was a last-minute decision toward the end of my pregnancy, but until the end of my pregnancy, I had already practiced and prepped myself for different pain management techniques and did all kinds of research on natural birth and different ways I could go about it. I was even going to try and have him without any pain medication. But different complications that I had by the end of my pregnancy prevented me from that, and I had to have a C-section. But you shouldn't feel gypped about that. The important thing is, like I said, you brought him into the world, you're both doing okay, and he's healthy and safe. Or she, if you're having a girl. So yeah, and so those are the different ways you can go about having natural birth. And a lot of reasons why women will go into a hospital these days. It's just modern medicine. Back in the day when women had to have their kids at home, they experienced complications, and, there was women that would die from childbirth, or their children, being born, would experience problems. And people back then just didn't know as much as they know now. So, that's why a lot of people can just go in the hospital and do it. But if the hospital's not right for you, like I said, we know more now than we did back then. As long as you're healthy and everything's going smoothly and your insurance allows it, by all means, go to a midwife facility. Go do it in your house with a midwife at your house. Just make sure that you do all your research. Ask your doctor all kinds of questions, or your midwife. And make sure that it's done the way you want to experience it. All women are different. Each woman is going to have a different experience. No two women are alike. So you really just want to do what is best for you and what you feel most comfortable with. And everything will go fine. Even if it sounds scary and you're petrified of what it's going to be like to give birth naturally, there's no reason. Take a deep breath. This is what women were made for. Our bodies are ready for this. Our bodies are made for this. It'll be fine. So just do all the research you can and ask all the questions you can. And if you also want to watch videos on women giving natural birth, do that too. Sometimes it's comforting to watch the whole process happen. I wouldn't advise that you have your significant other watch you, or not watch you, but watch the video with you, because men just can't handle it as good as women can. Like I said, it's what we were made for. They freak out when they see it. So, yeah. So unless you got a strong man that can handle it, don't let him watch the videos with you. So anyways, and thank you for watching, and check out my other videos. Bye.